Welcome to Speak On It with Who You With, Kurt Dog. I'm Kurt Dog. Want to welcome everyone to the show tonight. Hopefully y'all had a great week so far. It's Tuesday night, so you know what time it is. We are live. Want to welcome everyone on Facebook, YouTube, Twitch, Twitter. D Live is always in the house, and also excuse me, Anchor.fm. Uh, Want to welcome them to the show as well. As we record the episode for Anchor.fm, you can live chat with us in the chat room. You see the comment. Well, we have early election starting next Monday, February the 14th. Early election start, and then it's going to be an interesting election because for Attorney General, we have Lee Merritt. Rooting for him. Hopefully he win. We have a lot of other people that is up for it. That is running also. Um, have Keith Johnson out of Longview is also running. So if you're in the Longview, Texas area, definitely you get with Keith Johnson and support the brother. He's planning on doing some wonderful things out in Longview. And then also we have the governor race, which is a huge race here in Texas. It's time for a change. The Republicans have ran this long enough, and they haven't done anything to show for it. But whenever you listen to their ads, they campaign ad, only thing they talk about is the border, protecting the border. But the Republicans have been in place for over 20 years here in Texas, and they never talked about the border. And Trump started talking about it, and trust me, they're not gonna do much about the border. Every election they use this the border talk to make people paranoid and feel that they can use that to get people to vote for them. But you got to have more than just talk about the border. What else are you going to do? What are you going to do for the people of Texas? Because here it is. Greg Abbott haven't done much for everyone in Texas. He only catered to certain people that support him. And that's all to it. Ken Patson, we still waiting for him to go to trial for that he committed. So uh, I believe it was uh, fraud because he was supporting this business, getting folks to buy into this scheme, and he been charged. He also been charged with abuse of power of his office, uh, and he playing the system. And I say he's playing the system because he is the Attorney General, and what he's doing is going around and going around from going to trial, want to change venue. It was down in Harris County, Houston, Texas, and the last I heard, it's supposed to be going back up to Collin County where the incident took place. So it's time to bring Ken Paxton to justice. We need to get him out of office. We need to get Greg Abbott out of. We need to get Dan Patrick out of office. We need to get Sid Miller out of office, and we need to change the Board of Education because this critical race theory, they don't want it taught in a school, but that is part of America history. Uh, all the racist things that have taken place for century, and they want to cover it up. Well, the truth needs to be told. If we don't tell our kids about the history of America, it would die along with us. So it's very important that we can and let people know exactly how America have treated minority for years. If you think why you think all the ads talk about um, killers and drug dealers coming across the border, but we have that right here in the United States, still not doing anything to solve those issues. Um, I believe Reagan talking about uh, uh the drug war, um, trying to stop the drugs from being in America, but at the same time, America was the one that started putting it in our neighborhood. So the thing is, it's time to take a stand. Don't work on the candidates. Pick which one that is best for you, that's gonna stand for you, because whatever decision we make, it's gonna it's gonna affect each and every one of us, regardless if you Republican, Democrat, Independent. It doesn't matter. It will affect each and every one of us um, on this situation, because it's very important. And people say, "Well, my vote don't count." Yes, it do. If your vote didn't count, they would change closing voting location in low income areas. So your vote do count. They wouldn't be changing that, trying to keep it from making it permanent. Count. The only time your vote don't count is when you. And then on top of that, some people say, well, these small elections not important. Yes, it is. Once again, it is, for the simple fact that these small local elections is very important, because that's where are made from. They not gonna tell you that. They gonna encourage you not to vote. They're gonna tell you it's not gonna count. So yeah, you should get out and vote every election. It doesn't make a difference what's on the ballot. It could be one thing on the ballot. You should still vote and feel good about it, because you let your let your voice be heard on what you feel that you need, what you and your family need. So yes, it is important to vote in every election. So definitely get out and vote and take a stand on it. This this particular race, we started talking about it last year. It's gonna be a huge race. We all need to show up and vote for who we feel that is best to lead your state. In Texas, I know I'm tired of Greg Abbott. Him lying all the time, telling my COVID wasn't all that bad, but then turned around when he got it. First thing he did when he got the antibiotic, he have access to medication you don't have access to. Dan Patrick must remember, a lot of people have lost family members um, due to COVID, and Dan Patrick made the statement: the elderly would prefer to die to open up the economy. But at the same time, he's not the ones having to deal with the aftermath of losing a loved one to COVID. So it's time to make a change. And Ken Paxton, all those bogus lawsuits that he filed after the election, spending our tax dollars to try to get our the presidential election overturned, which it was wrong. As a matter of fact, he's being investigated about that too. So it's time to make a change. Take a stand and say, hey, enough is enough, because they don't care about you. Only thing they want you to do is pay your taxes and be quiet, sit on the porch. But we need to let our voice be heard loud and clear, and let them know we're not going to continue to um, allow them or put people in place to be able to do whatever they want to. When you run for an elected official office, you must be for everybody, and not just for a certain group of folks. And these leaders that we have here in Texas is only for a certain group of folks. So yes, it's time to take a stand on it, and it's time to make a difference. So next Monday, go ahead and vote early. Primaries March 1st. Don't wait until March 1st. Starting next Monday, get out and vote. Go vote. I don't care where you at. Uh, Find out if you're able to vote. I know here in Texas, um, and you cannot register to vote now if you're not registered. But in certain states, some states you can still register, but you can also go ahead and prepare. That's why I tell people all the time, prepare for the future. For the simple fact, if you get registered now, when the next election come up, you don't have to try to get ready. You're already ready. So get out and get registered. Um, and if you move to a new county, district, or state or whatever, make sure you change your voter registration. Or you're going to have to go back to that old county and do it. In Texas, the deadline is already passed. It was January 31st. So now you will have to go back to your old county. But we need to make a difference. Don't take much to drive to the other county. If you're close by, vote. Let your voice be heard. Regardless of where you're located, whatever. Find out the rules of your state, the election, on how they doing. I know personally, um, just like I said with Trump, I don't care who running against Greg Abbott, but all these folks, not voting for him. Uh, Beto right now is the best candidate. Um, I think he's the best one to lead us the most. Um, and then for the Attorney General, I feel like Barrett. We see the work that Lee Barrett does for everybody, not just for black people. He does it for everyone. Civil right. He wants the right things to happen. Those are the type of people we need in office. Somebody who's going to be for everyone and not for just one group of people. Um, but that's my opinion about it. Do your homework on your candidates and get out and vote. Um, Now, we're a little tonight because I was doing some research on this and I was like, is this true? Is true? This $30 million that Biden administration is looking for non-profit groups to distribute crack pipe kits, and um, it been said that uh, they thinking about Health and Human Services thinking about doing injection sites. So it's interesting. And I have a question to ask people because I don't know. Um, I want to know how you feel. Would you prefer a crack pipe kit, a safe injection site, or drug rehab for people? Which one would you like? Welcome to the show, T Cal. Um, I'm glad that you were able to make it in. Said it started to pick up at work, so I couldn't see the start, but I'm here now. We actually just came on. Oh, I guess we've been on for about 10 or 15, about almost 15 minutes. So um, we came on a little bit late because I was doing the research on this $30 million for crack pipes. Um, I want to know how do y'all feel? Um, do you feel that providing crack pipe now let me read the story first because I don't want to go out of line or anything like that or assume. I'm gonna read a press release that HHS did back on December the 8th. Excuse me. The Substance Abuse and Mental Health Service Administration is now accepting application for the first ever SAM HSA harm reduction grant program and expect to issue 30 million dollars in grant reward. This funding, authorized by the American Rescue Plan, will help increase access to a range of community harm reduction service and support harm reduction service provider as they work to help prevent overdose death and reduce health risks often associated with drug use. Um, SAM, HSA, SEP, application from state, local, tribal, and territory government, tribal organization, nonprofit, community-based organization, and primary behavior health organization, with overdose death exceeding 100,000 over a 12-year period for the first time. This opportunity will provide support to those working in their community to reduce the harm of drug use, providing funding and support for innovative harm reduction service is in line with the Biden-Harris administration ongoing effort to address the overdose epidemic, and it's a key pillar for the first time in a multi-faceted health and human service overdose prevention strategy. October, this funding allowed organizations to expand their community-based overdose prevention program in a variety of ways, including distribute overdose reversal medication and fentanyl test strip, provide overdose education and counseling, and manage our expanding syringe service program, which help control the spread of infection disease like HIV and hepatitis C. The reality of evidence-based harm reduction services are out of reach for too many people, said National Drug Control Policy Director Dr. Gupta, who also announced the new model law to help states ensure access to safe, effective, and cost syringes program. Service program building Biden-Harris administration to expand evidence-based prevention, treatment, and recovery support service. The historic funding will help make harm reduction service more accessible so we can meet people where they are and save lives. Too many America, more than 100,000 people over the last year have lost their lives to drug overdose. Our new HHS overdose prevention is clear. Harm reduction service and critical to keeping people who use drugs alive and as possible. And Health and Human Service Secretary Xavier Becerra, American deserve health service that address the full range of drug use and addiction issues. And this funding will help provide those services in the neighborhood in which they live. Um, and harm reduction service will help keep America alive. Rittman, PhD, the Assistant Secretary of Methamphetamine Substance Use and the SAM, HSA. Thanks to the American Rescue Funding, harm reduction service uh, providers in historical under resource community will receive long-awaited support to help stem this disproportionate number of overdose death and related health issue facing those community. SAM HSA will distribute $10 million per year over the next 3 years. Grant reception must use the fund to support harm reduction service. Harm reduction service provider will be asked to develop or expand evidence based service that may include, but not limited to, the provision of sterile syringe, safe sex kit, prevention education about synthetic opioid and other substance overdose prevention kits include peer work and engagement, medical service, case management, and referral to treatment. Warm handoff that facilitates engage in care and refers to treatment for individuals seeking these support service are also critical compartment of this grant program. Harm reduction service will be trauma informed and guided by a harm reduction stakeholder group and other community members. Now that's the press release that was released on December 8, 2021. So it's kind of Uh, it sound good, but how long have we had the crack issue? But now opioid, who mainly is not in the low income area that it's affecting the most, but now they able to come up with a program, come up with money. I'm just saying, but I want to know your opinion about it. Well, today it came out that Biden administration to fund program to hand out crack pipes. This is according to Fox 5 out of New York, I believe. The U.S. Department of Health and Human Services reportedly seeking to give grant to programs that hand out crack pipe to drug addicts as part of a program to keep users safe. The ideal is limit to infection among users. A 30 million Biden administration grant program include money for nonprofit group to purchase safe smoking kit supplies, according to a report. Um, the pipes also hopefully convince people to smoke instead of injecting drugs because injection are reportedly riskier. San Francisco and Seattle have tried crack program. News of the pipe program came to the Justice Department signal that it might be willing to allow safe injection sites for people to use heroin and other drugs. The first official authorized safe injection site opened in New York in November. The two facilities, which the city calls Overdose Prevention Center, provide a monitor place for drug users to partake with staffers and supplies on hand to reverse overdose. Advocates have held them to curb the scourge of overdose death. The New York City site so far have intervened in more than 125 overdose among more than 640 users, many of who have made multiple visits, according to On Point NYC, the organization running them. Um, so I really want to know your opinion about it. Do you think it's a good idea to provide crack pipes um, to drug users or syringes to heroin and meth users um, instead of providing help for them? Now, I've worked with um, different people that have used drugs and different organizations that actually work hand in hand on them. But one thing I did learn from my experience dealing with someone that have a drug issue, um, you really cannot offer them help until they're ready to get help. You can offer them help, but they would lie to you. They would say, "Oh yeah, I'm ready. I'm ready." Then when it's time, they don't show up. Normally, when a person hit rock bottom, that's when they ready to get help. Um, T-Cal asked a couple of questions. Said it started to pick. Uh, oh, said, "What's the story? What's going on with crack pipes?" It sound crazy. T-Cal said, "Like I said, it sound crazy. It's getting busy, so I have to go back to work, but I'll check back as fast as I can." All right, have a good night at work, and um, hopefully you make it back before we get off. Um, so um, I wanna I wanna understand your opinion about it because you could call in or put in the chat like T-Cal been doing. I want to know how you feel about uh, this program, uh, providing the necessary need to use the drugs, um, and one of my biggest thing when they talk about meth, yeah, it's meth in the hood, but when you talk about opioid, that's not necessary in the hood. That's normally found uh, in a more middle class, upper class area, which I believe when Trump came into office, remember him signing a bill about providing help for them. But for years, crack cocaine have low income area. Now, as far as I can remember, I don't recall any type of program like this to prevent people from uh, dealing with this. Yeah, it been drug rehabs and stuff like that, and it been nonprofit or some churches that will help for people to get off of those drugs. Um, and I've known people that have recovered from those. Um, that was once on drugs and they made a full recovery and now they reaching back and trying to help other people to get off. So is um, program, is it actually for everybody? And then if they only going to provide 10 million a year, 10 million a year across the country for 3 years, how far is that going to go? I'm just asking because that's not a whole bunch of help. And you talking about rehab, you talking about across the U.S., that's not gonna do too much. But then the question come up, uh, like in New York, safe space, safe place where they could go and use their drugs. But where are they buying the drugs from? Should the money be used to help them get off of drugs? Or should you do what you're saying with this money? I'm just kind of curious. Um, my um, thinking about this, and I'm like, okay, now they're gonna provide all the supplies you need. I've talked about on the show um, where I went into a location here in DFW and this service station, nobody did look like they from the neighborhood, but they was providing uh, some of the supplies for crack pipes. And why are you selling this in our neighborhood? And you're not even from the neighborhood. Which a lot of these little small convenience stores are not from the neighborhood. And I'm just kind of curious, how is this gonna, what about, just throw it out there, what if a person is on their way to one of those sites? They had with the drugs to get there. What if they got stopped before they made it there? Are you gonna arrest them? These are questions that came up as I was reading the story. I'm like, how's this gonna work? But that's 30 million tax dollars. I'm not opposed to helping people get off drugs, but I do have issues when you are supplying, helping a habit out. That's an issue. I think that could become a bigger problem in the long run. Uh, if you're just not tuning in, you are listening to Speak on It, Kurt Dog. I'm Kurt Dog. We're talking about this $30 million Biden administration is given to supply crack pipes and to have a safe place to use drugs. But also, um, I'm just curious on how they gonna do this, where it's gonna be beneficial. Are they helping these folks get off drugs? Are you just gonna get them a safe place to get drugs? And then also you got to look at it like this: when you're dealing with uh, crack, a lot of time it's a group of them come together and smoke crack. It's not in person. Normally, it's a group of people that will come together and smoke crack. And normally, it's probably going to be a fight. Hit it more than somebody else, it may be a fight. So, I'm just kind of curious, how is this program going to work? How is it going to benefit people? And here it is, we have kids on the bed hungry. Yeah, we have kids going to bed hungry. They don't know where their next meal is coming from. We have when virtual learning or school is out, who's the district trying to provide meals for kids because they don't parents don't make enough money to provide food for them. Sometimes the school is the only meal that a child may get. So I'm just trying to wrap around it, see how providing crack pipes and safe place to smoke your crack and all of this. I personally, I feel like it's going to be a bigger issue for the simple fact providing all this place for them, but what about the help to get off of it? What I'm concerned about, because if a person gonna go to a safe place where they won't get arrested, they can smoke their crack, do whatever they want to, then what? And we've seen the shows, we've seen in some of our neighborhoods, um, where a person that is addicted to crack, they would do anything for $1 to get bump. So how is that gonna help the community? I'm just curious about it. That's my opinion. I have questions about it. What is the thought pattern of final outcome of this? Because if you provide in a safe way, yeah, I know uh, some people happy about it because that means if they got a safe place, the crackhead can go smoke it. Guess what? That means they sales finna go up. But how is that helping that community? How about these communities where the closest store is 3 or 4 miles away or longer, and they don't have the transportation to get to the grocery stores? How about that? I'm I'm just curious about all of this, but opinion. I'm wondering how is all of this gonna play out. I would like to know answers. Um, just throwing 30 million in it, I don't see 10 million a year for the whole US to provide these servers. I don't see that's enough money. And what is the final outcome that you're looking for to do these type of programs? 30 million can uh, a lot of people out. A lot of kids don't have to go to bed hungry. I mean, so That's my opinion. I want to know how you feel about it. You can call in 972-591-3665. 972-591. If you call in, please do not block your number. I get about 60 spam calls every day. Yeah, talking about medical health care, asking me if I want to connect with a operator on the voicemail. So I don't do spam calls. So if you want to call in, that's fine. Um, Also, we're going to talk about Canada a little bit. Wish my brother from Canada, Radio Chaos, I know he will have more information on it since he's up in Canada. And the protest that is going on up in Canada um, about the mask mandate. And it's, I've seen the news last night about it. The trucks have stopped in the middle of, and from what I seen a while ago, we really don't have uh, they don't have an end to it because I think the tow truck companies are not working with officials to remove those vehicles, and that's an issue too. Now, I know that at one point it was uh, a guy running up in Canada. I think for I forgot what position he was going for, but he was more like um, I want to say it was there. I'm not quite sure. Kind of market itself after Trump, and I don't know if this is another stunt that he's doing, encouraging about the mandate. I'm not sure what it is, but if you are up in Canada and know more information about it, definitely let us know because we need to know. Um, there's a lot of stuff going on up north, so the protest and um, I believe I even seen one Confederate flag on it. Yeah. So it's kind of crazy up in Canada right now. All the protests that are made, and Canada have been pretty strict when it came down to COVID. Um, Radio had told us several times on the show that Canada don't play around with it, and they have some shows where I know at one point my wife and I was thinking about Canada, and uh, we was informed that if we did, we need to make sure we have plenty of time because we will have to quarantine, I think, for like 3 days. And if then we had to take a test every day or something like that. It was crazy. So we said, no, let's not do that. We'll come back and visit that later on. But I'm just kind of curious about what's going on up in Canada and how everything is coming out. But also, uh, don't get it twisted. I know here in the States, um, in DFW, they're saying our numbers, our hospital stays are going down. The numbers have dropped. I think over $1,000, over not $1,000, but over 1,000, uh, gone down by 1,000 over the last week. As for hospitalization here in the DF in Texas, or in DFW, I'm sorry, but COVID is still alive and well. Um, I was talking to someone last night that informed me that um, they lost a um, um, informing that they lost a loved one due to COVID. And they said the problem is the whole time they said they had the vaccine, they taking it, but it came back they did not get the vaccine. They admitted on their deathbed. So we have people lying, saying they don't trust him, and unfortunately, COVID, it affects everybody differently. Some people have it worse than others. Some people have it worse than others. Some people may be real bad. But the thing is, um, you do what you have to do to protect you and your family. Because COVID is real. It's real. Like I said back in December, I was um, and symptoms never test positive. Had the symptoms, never test positive. And after about a week, I was feeling better. My wife ended up testing positive. I still test negative, but she tests positive. Both of us had the vaccine. Since then, I've had my booster. So, um, but it's different because here it is. Luckily, we've always take our vitamins. Try to make sure our immune system is great because we both work with it, and we have to protect ourselves. That's what we did. So during that time, I would tell anyone, if you had those symptoms, sick, now check with your doctor. I'm not a doctor, so don't take my advice. I'm telling you what my wife and I did. Um, Even though we had this, we made sure we drank enough fluid in our body, uh, mostly water, and uh, different type of juice with a. And we also made sure we ate, even when we didn't like it. We forced ourselves to. We did not lay around day long. Forced ourselves to get up, move around. No matter how we felt, we constantly move around. Got up in the morning. Now I will cook breakfast. Um, we eat breakfast. We wouldn't, even though we was tired, we would not go lay in the bed. We stayed up. We forced ourselves to exercise during that time, which helped us too because um, it make a difference. But if you just laying around, you that give that virus to set in your chest and you start having issues. Um, so we did all of that. Made sure we stayed on top when we took our showers. I would tell people to even for COVID, I always did it thanks to a friend from back in the days. She actually told me years ago, um, if you have a cold or something, let that hot water run on your back. It'll help break all that mucus up and it'll come up. So I've been doing that for over 20 years. And that's um and that's what if you had the symptoms, uh you should definitely um do what you have to do to protect yourself. Uh Freedom Channel. Thank you for tuning in. Been a while since you've been here. Are you the fitting biting on this one? Well, you came in late, so normally I tell you go back and watch the show, but you should go back and watch it anyway. Um, I don't understand what's the purpose of it. It's kind of like you saying it's okay to use drugs, and I don't agree with it. I think it should be. I think it should go to more of a rehabilitation to help get them off of drugs. So, and you got to read between the line because Trump signed that bill about the opioid crisis about a couple of years ago, I believe, and he signed that bill. Now, it, they started calling it an opioid crisis, and reading the press release, I believe I said it was December the 18th came out, they mentioned opioid in there quite a bit. So I think this bill is basically for the opioid community, for the ones that use that, and they just said crack pipe to make it seem like it's going to the black community. But $10 million for the entire United States per year for the next 3 years, that's just not enough money to do a war on drugs. It's not. And to provide supplies for that, I don't think it's enough because you providing them the necessary tools to use these drugs, but what about the tools to getting them off of these drugs? That's what I have an issue because like this, I do not support no one habit. I don't support nobody habit. I remember years ago, I had an associate come to me and ask me for $20, um, which I knew if I gave it to them, I wasn't going to get it back. No, but they said that $20 was to give me a $10 bag of weed, some cigarettes, and $5 for gas. Well, that tells me your priority is wrong, and I'm not finna support someone happy. If I would have gave them that $20, that would have been supporting their habits. I'm not supporting it. If you need to be able to support your own habit, I won't support that. So hopefully that answers the question. Um, I know you can do a tight buy and then roll on out. Um, but I don't outcome in this, and I think it's mainly a situation where focusing more on opioid than they are on crack cocaine. I just don't. Crack been around since these. Reagan war on drugs. That was all about the crack. Um, Say no to drugs. That was all about the crack cocaine. But since the 80s, it's still around. I think it was early 80s, 85, something like that. It's still around. But they never had far as I know, they never had a resource like this. It's easy to put lipstick on a monkey and say, oh, this is a beautiful woman. But at the same time, you can do a program and say, oh, this is for provide crack pipes, but then you use that money for other things. The headlines say crack pipes, kids, or and they thinking about doing injection sites. I don't understand the logic of that. Yeah, it provided them a safe place, but what's the ultimate outcome? You're gonna have to pay someone to sit there and watch them as they smoke this crack, or as they inject meth or heroin in their arm. And the thing is, what's the ultimate outcome? What about the health of the personnel that have to be there to watch it? Because if someone go in cardiac arrest and they have to go in there and help them, what about the fumes and all of that is in the air? I don't see it. I don't understand the logic of it. So um, I don't think it's a good idea. I think it's one of those things that's a cover up. They say it's for crack pipe to please the black community or the low income community, but in reality, it's to benefit other areas, other drug use. So I don't think it's a good deal. But that's why it's important for us to vote, because we have a leader we put in those positions that gonna authorize this, and guess what? It's nothing we can do about it, and that's all to it. Nothing we can do. Election time next time, and then we show them that hey, we're not dealing with this no more. So I think you just did a type by because you haven't responded. So I assume you just did a type by and kept on rolling, which is cool. Um, uh, I mean for meth head, they're considering safe um, injection spots also. Uh, so I know you said merch head. Are you talking about shopper heads? Because I know people be shopping. Um, so they are looking at having safe haven for the injection spots. Matter of fact, New York have a safe haven um, for people that use heroin and other drugs. Um, uh, they opened theirs back in November of last year. It said the first official authorized safe haven for people to use heroin and other narcotics have been cleared to open in New York City and hoping to curb overdose, the Mayor and Health Commissioner said Tuesday. The Overdose Prevention Center, commonly known as supervised injection site, has been discussed for years in New York and some other U.S. cities and always exist in Canada, Australia, and Europe. I wasn't aware of that. A few unofficial facilities have operated in the city for some time, allowing drug users a monitored place to partake. Um, it say that the facility save lives by recognizing the reality of drug use and providing a place where users are watched for signs of overdose, which claim a record number of lives in the city and nation last year. I'm proud to show um, cities in this country that are that are that after decades of failure, a smart approach is possible. Um, so yeah, they have them in New York. So I don't know. I asked where is radio too. I might need to check up on them. Send them an email. Um, I need to know that myself. TK said I want to know what they do in Canada and if it works. Um, so I'm curious about it myself. What radio, I know with all the protests going on about the uh, mask mandate, uh, he I'm not sure where he's at. Uh, I think he came on last week. So, uh, but this protest been going on for the last 3 or 4 days, I believe, and it's gaining speed. So, I would definitely like to have more information on that and see what's going on. Um, and hopefully, if he catch the show tonight, he can always uh, come on tomorrow and talk about it. Cause sometimes he may work late and then he'll catch the rerun later on. So he could be doing that too. And hopefully, if he's catching the rerun, he can come on tomorrow and let us know what's going on up in Canada, and also about the program Canada have about the injection. Because I said, oh yeah, I forgot about that. You definitely may need to check on him. Yeah. Um, uh, I should have sent him a message earlier and to see if he was able to come on the show and talk about it tonight. So, but I hit him up once I get off, shoot him an email, and he'll normally respond pretty quick. So, but then it's no telling what's going on. I'm not sure what area he lives in, if it's close by the protest. I'm not sure, but tensions is very high in Canada, and I would just say, uh, right now this whole need peace, because what's going on overseas, going on with Russia, and countries up there is crazy right now. Everyone is on the edge. So I would just ask for peace for everybody, because right now it's crazy as hell. To be honest with you, but please do not forget. Um, uh, early voting starting next Monday. Um, so that's a good thing. Now I will say, um, here in Dallas, um, this just came out today. I'm gonna try to read it real quick. I may not have time, but hold on, let me do this because I'm not gonna have time. Hold on. You are listening to Speak on the Kurt Dog. I'm Kurt Dog. We've been talking early voting that started on the 14th, and also we've been talking about this uh, also we've been talking about this $30 million Biden administration uh, grant for providing crack pipe in a safe place for people to smoke crack. And Health and Human Service is considering a safe injection for users to help prevent overdose. So that's what we've been talking about tonight. We even hit a little bit on the Canada protest, but in the middle of everything we talked about tonight, Dallas County have done some big things and made some difference um, in some people's lives. Dallas County turned Oak Cliff apartment complex into a transitional housing. Um, Dallas County is buying an apartment complex in East Oak Cliff designed to offer people a fresh start. The complex will become transitional housing for men coming out of prison, and it's a public-private partnership with the Regional Black Contractor Association. The county invested 6.7 million to buy the complex with American Rescue Plan Fund. American Rescue Plan. Same program that there's 30 million going to. We hear people who talk about reentry. We hear people who talk about a second chance, said Commissioner John Riley Price. The county is buying the complex at 2125 2nd Street to become 1 year transitional housing for a man returning from prison. What we noticed coming out of the prison system, they might be couch surfing, not typical on the street per se, but still classified as homeless. It's hard for those people to get, and once you get to those background check questions and previous rental history, it's just another barrier, said Kimberly Shaw, Regional Black Contractor Association. Police said the county found a unique way to use the fund. It was very creative. What the Biden administration said to us is you must have town hall meeting. Town hall meeting, you will get an excursion of what use those funds for. Police Price said its new name Lockridge Housing. It's named after one of the first black state legislators from North Texas. It has approximately 70 units to be in training for a job through the Regional Black Contractor Program with Dallas College. It gives them skills, training, and certification that make them competitive when they go into the workforce, Shaw said. Some 100 members of the association hire these men and building their own workforce while building back the lives of men. There's support from others who know this journey, like Anthony Virgil, someone who been in their shoes, who walked through their process to help them to navigate through this process, so it will be a smoother transition so my role is very simple, is to help them, Virgil said. To be able to give them that opportunity to be citizen in terms and valuable, Price said. When you give somebody a job, the amount of self-esteem you will rise, and that person, the self-reliance in this that goes a long way, doesn't just affect them, it affects children, the community around them, and it has a very long lasting effect. The complex is set to open in a month and a half. Great job, John Riley Price and the Black Contractor Association. See, that money should be used for stuff like grants like that. We talk about um, um, people talk about the prison system all the time. How a lot of people, they come home from prison and they don't have a plan, and they end up going back to prison for the simple fact they don't have a plan. They're to prison, do their time, whatever they went to prison for. They end up doing their time, and all of a sudden they back in the system because they cannot find a job. They don't have the skill, and they're limited to what they can live. And a lot of them end up, and sometimes family members don't want to deal with you if you've been in prison, for whatever reason. So, or you find yourself back in the same situation you was in before, but through this program that Dallas County is using this money for, the same money they talking about providing crack pipes, and safe places to smoke crack. They use this money for something to encourage, to help build up their self-esteem, give them opportunity to get back into the workforce, and where they can provide training, something that nobody can ever take away from them. But if it's construction, that seems like that's mostly what it's going to be, but it's going to provide training for them, a trade school that they could go through, and they go in there and learn this training, and sometimes the experience that you have, people would overlook your background just because of the work that you do, and they will give you a better opportunity. So they giving them training, but then they also giving them this opportunity. So um, so that's always a good thing when it's stuff like this. That's where the money should be going to, trying to rebuild the community, trying to provide opportunity, a fair opportunity to the income areas. Um, I'm not saying everybody gonna do the right thing. Um, some may do the right thing, some probably won't, but they have that opportunity where they can do it and better themselves. T-Cal said, well, I have to go. It's time to start wrapping up at work. Have a good night and great conversation as always. I appreciate it, T-Cal. Thank you for always supporting the show. Um, so that's where that money should go, to build up communities. Um, it's so many stuff. A lot of things goes on in the city of Dallas that um, can't remember all of them, but kind of like I believe it's Dixie Circle. They have a farm out there where they actually grow their own produce, vegetables and stuff, and um, that's given back to the community. So it's programs like that that we should pour into, programs that are doing positive things for the community. I'm not saying some of these people that may get part of this $30 million grant is not going to do what's right, but what's the solution? Just provide a place for someone to smoke, crack, um, and provide the supplies they need to do it. I feel like that's a hindrance to them, and it's not helping them. It's giving them that safety net. Oh, I could go over here and buy this crack. I could go here. I can smoke all the crack I want. And if I OD, they dare to save me. I'm just saying. I never smoked crack before. Never been my thing. Um, but I've seen what it do to people. I see what it done to families. So it's not a good thing. I feel like providing the supplies for them is not always good. Um, but I think providing opportunity of people coming out of prison and giving them the opportunity to get ahead, to even the playing field, because I know people that have done time in prison, um, uh, and some things I've done with the communities. People would say, "Hey, can you help me find a job? I have a background." So it's a lot of organizations that is out there that will hire someone with a bad background. But also, even when I had my trucking company, I would try to help guys out of prison to get them that opportunity, because I knew as a truck driver, a lot of companies was not gonna get them those opportunities. So I'm like, hey, I try to give them that opportunity. Some of them was pretty good, some just not all that good, but I at least tried to help them. And sometime in that industry, in the trucking industry, a lot of people would lie to them uh, about how much money they're gonna make starting out as a truck driver with no experience. And it's not where you're gonna come out and make whole bunch of money, paid my drivers pretty fair. And we drove locally. Paid them between $800 and $1,000 a week, which is damn good. Monday through Friday, as a truck driver. But that went good for about a month, 2,000 a week. Well, wait a minute, you're not doing work, and you're not gonna be able to make that type of money being at home every night. So that's that's the way. But that was the lies that was told to them. Oh, if you get your CDL, you can make this, you can make that. But they failed to inform them you're not gonna make that at first. You have to get enough experience up under your belt before you start making that type of money. And sometime as a company driver, you would never make that type of money. Not being at home every night, you definitely won't. So, um, but hey, um, each his own. I've always try to look out for people that, uh, if you're trying to help yourself, I don't mind trying to help you. Bottom line, I don't care who you are. Long as you're trying to help yourself, I will help you. Um, but if you're just seeking for a handout, mm-mm, that ain't gonna work. But um, we have a couple more days left together. I know we do Tuesday through Thursday, so we got Wednesday night and Thursday with Miss Risky. Um, um, if it's ever any story that you want us to talk about, you can always email and excuse me, and I will respond back to it. Or if you're following me on social media, um, that's probably the best way to do it. Be honest with you. You follow me on social media, just shoot me a message. I will respond to that quicker. You can shoot me an email, who you with kurtdog at mail.com, who you with kurtdog at mail.com. And we can, um, if it's a topic you want us to talk about, shoot me an email. We could definitely get it in. And if um, you could do that, or if you have questions, because we normally have counselors on. We're trying to do it once a month, but we're trying to work out the schedules too. So um, we could do that. I'm going to be reaching out to a young lady that I met last month, and have her on the show to talk about what she's doing. And if you are a small business doing positive things in the community, hit me up. Um, we would highlight you, and um, because we got to support each other. Hit me up. We can highlight you and go from there. We are looking for sponsors, so don't get it twisted. If you are uh, looking for someone to sponsor you, hit us up. We can always come together and we can sponsor you. If you're dealing with food or something, make sure you have some good food. I can't be sending folks over there and food ain't all that good, but definitely if you are a company that's looking for sponsoring you, and we'll make arrangements to meet with you and go from there. Um, at tomorrow night, I will be back if the good Lord say the same. Um, so, uh, until then, I love each and every one of you.